Hi, everyone. Good morning, good afternoon, wherever you're calling in from. My name is Cindy Sagoe, and I work with the National American Indian Alaska Native PTTC. We're here at the University of Iowa, and welcome to our webinar, the Indigenous Resiliency Thriving Prevention Programs. Next slide, please. And so the PTTC Network, our center, the American Indian Alaska Native Prevention Technologies Transfer Center, is part of the PTTC Network. We have 10 regional centers all over the country, and we also have a national coordinating office in Kansas City. We also have a sister center, the National Hispanic and Latino PTTC. Next slide, please. This our project is sponsored by SAMHSA, and although it is sponsored by SAMHSA, the content is developed by the presenter, and the opinions expressed do not necessarily reflect the views and policies of SAMHSA, HHS, or the American Indian Alaska Native PTTC. Next slide, please. So following this event, we will be sending out a follow-up email with presentation slides and recording. We would also have a link on how to request and receive CEUs and a link to our GIPRA surveys. So please take the time to fill out our surveys. This survey is very important to our center and our funders, and it helps us know that our events are beneficial to those who attend. Your participation is voluntary, but we really appreciate if you take a few minutes to help us complete this survey. Next slide, please. And although we are gathered virtually today, we wanted to take some time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcefully taken and inhabited. So please take a moment to read this land acknowledgement that was created by 3 members of our team, Ella and Kelly Driscoll, and our co-director, Sean Bear. And even if you're not able to finish reading out this land acknowledgement, you can find it on our website, or you can also reach out to me or any members of our team to send you a copy or a link to it. Thank you. Next slide, please. And today we have Justine Murray. Justine has had a career dedicated to assisting organizations to harness their power of service, strengthen capacity, and implement solutions addressing critical needs in communities around the world. She's done this through her work at the Peace Corps, AmeriCorps, and other organizations. Ms. Murray has facilitated sustainability planning with tribes, nonprofit organizations, for-profit entities, governments, and individuals. And I'll give Justine the opportunity to introduce herself after I pass on to Shirley to start up our session in a good way. Over to you, Shirley.
Okay, can you hear me? All right. Make which, Cindy, for the wonderful introduction. And I just wanted to remind people too that the importance of the land acknowledgement, a lot of it is no matter which land you're from, whether it's, in Alaska or in New York or North Dakota, South Dakota, whatever land you're from, it's good to acknowledge the land that Aboriginal people were upon since time immemorial. And also to acknowledge this, especially because Monday was Indigenous Peoples Day. And it was a day to not only look at the genocides that have occurred, but the resiliency and the good things that Native Americans have contributed to society. One of them is to have military, one of the highest rates of people being in the military and serving. And then also one of the things that Biden presented a proclamation, and one of the things he acknowledged in there was that Natives have the highest rates of vaccination in the US right now. So there's some really awesome things that Natives are helping to do and leading the way. So make good for that land acknowledgement. And I'm going to start it off with a prayer, and then I'm going to sing a song. And to start off our presentation today. Yep, she's recording now. I'm going to sing a different song than I usually sang, and I saw it again. A little girl sang it, and she just was like so beautiful the way she sang it. And she sang it a little, she had a little slight variation than the one I'm going to do, because I learned it from elder women. And so, and it's called a Cherokee morning song. And I know it's morning in the Pacific, so I'm going to stick with the morning.
Good.
And if you want to learn it, that's why I'm saying recorded, because you can learn it. It's so simple. And I wore my moccasins today too, because I'm rocking my moccasins every day if I can. So I'm going to back up so I can so you can see me. When they are oh, when they are oh, when they are oh 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 hey ya 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 ya. When they are oh, when they are oh, when they are oh 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 hey ya 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 ya. When they are oh, when they are oh, when they are oh 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 hey ya 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 ya. When they are oh, when they are oh, when they are oh 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 hey ya ya ya. Woohoo!
Wow.
Joanna Missionan. What that means is Joanna Missionan means have pity on us and love us, Creator. Oh, Megwich. And next we have is Justine. Megwich, Justine, for helping us out.
Oh, my goodness. Thank you so much, Cindy and Shirley, for starting us off. And Shirley, for your wonderful prayer and your song celebrating the morning and getting us all in the same room. Thank you so much for that. As Cindy said, I have spent my professional career supporting and working with individuals and organizations as they work to address the critical needs in their communities. And one of the most important things that I have learned throughout that time is how resilient organizations are and how important it is for organizations within that resilience to think about the stability of sustainability and how to build that and work with that as they continue with the wonderful programs that they're doing to meet the needs of the people in their communities. So today, I have the honor of presenting to you a sustainability framework, which we've developed over the years to help organizations look at who they are and where they are and how they can become even more resilient. So I'm going to do that and articulate the areas that I hope you'll consider as you think about this. And then absolutely, there's time to share both the successes and the challenges that you've had, so that at the end of our time together, my hope and expectation is that you'll have some good ideas for next practical steps that you can take in this process. Let's talk a little bit about resilience. I know that you know resilience in ways that some of us have never, ever experienced. You know how to adapt. You know how to step back. You know how to swing with the winds of change. And believe me, I also know that in this last 2 years, we have all experienced winds of change that we never expected. We never expected to be in the face of a pandemic as we were continuing to support the programs that we had started. We started these programs before a pandemic primarily, had great ideas what we were going to do, and suddenly many things were shut down. But you have been resilient through all of that. And one of the pathways to resilience is sustainability. And that's the one that I'm privileged to talk with you about today. Let's start with, and before we start this, let me just back up with a couple of housekeeping details. Please feel free to turn on your videos so that we can see who's in the room. I think there are about 40 people who have joined us, and it would be wonderful to have your videos on so we can see one another. There's also going to be a chance, we're going to be working some in small groups, so you'll have the chance to really work in a small group. For now, you are muted, and please, if you have comments or suggestions or questions, please put them in the chat because we're following those along as we go along. So to start that off, I'd like to hear what you think. What comes to mind for you when you think of sustainability? If you would just put them in the chat, put your ideas in the chat to everyone, then we can all follow along. Oh, Daisy, sorry. Keeping needed programs open, absolutely. Long-term benefits, long-lasting, carrying on, keeping your program continuing. Continuation of the efforts and the outcomes. Yeah, the next generation. Oh, golly, yes. We've got to avoid staff burn. Resiliency, future-oriented, endurance, program need, building on something that's been there, and adapt. Adaptation that's totally about resilience and sustainability. Continuing to do good work. Those are all wonderful comments. Yeah, the programming can continue. Programming that the community loves. Isn't that true? Adaptive renewal. We want to renew, but do it in an adaptive way. Yeah, continue to grow and adapt throughout the years. Oh, you absolutely have the core of resilience and sustainability. How we define it is and you've all said this, the ability to continue to meet the needs of the people served by the project with resilience, that ability to adapt, to go with the flow, to let go of, to do that beyond the life of the specific grant or with diminishing support. Being able to think about it into the future, if you will, in ways that none of us can really understand right now. Oh, I love this. I just saw it in the chat. We have great example of sustainability from our ancestors. And isn't that what this slide says? Yes, it's the ability to continue to meet the needs of the people served beyond the life of the specific grant or with diminishing support. So what we think about is sustainability as a mindset. Absolutely. First of all, as you've all said, it is sustainable, it's worth being sustained, and we can sustain it. And it's also strategic action. It's not going to happen on its own. We are making actions, and I submit to you, and you all know this, that you have been acting towards sustainability from the beginning of your program, from the beginning of your project. Each action that you have taken has gotten you a little bit further down the road. Sometimes that's hard to see because we think of sustainability as way out there and something that's coming down the road, and we forget. And also we get so involved in the day-to-day activities that I know some of us are just head to the grindstone in terms of what needs to be done today. And we're hoping somebody, goodness sake, hopefully somebody is taking care of sustainability. But each of you have added to sustainability and the resilience of your project by the relationships that you have and the actions that you've taken. And that's what we're going to look at today. So as we get into this, think about, if you're thinking about your project specifically, think about what you'd like to sustain. You know, if you are facing limited or diminishing resources, you're probably not going to be able to continue everything in the way that it has been going. So think about within the activities that you've been doing, which ones are important for you to sustain. There might be some that you've been involved with that others are doing, and that really what the best thing to do is to shore them up to continue to do what they have been doing, and you let go of that piece. There might be others, like for you, what has been your unique niche? Like perhaps you are the ones that have really found a way to message positively the idea of drug usage, the idea of addiction. You've been able to message that in ways that nobody else has. You've been able to create videos and other means of communication that nobody else has been able to create. And you would like to continue doing that. So you want to think about what it is within your long list of activities that you really want to sustain and that is important to sustain. Having that as a backdrop, I want to present to you our framework. And we think about it, whoops, somehow this just keeps slipping ahead. I don't know how. The people are, and my computer is saying, you need to talk faster. I don't think I need to talk faster. So let me just slow down here. We think about sustainability in 4 pillars. Think of it as a table with 4 legs. Each leg needs to be strong and steady and supporting that part of the table. I know we've all had experiences when we've been out to dinner with a group of people, and one of the legs is slightly askew. And every time you pick up your fork, it tips just a little bit. And you keep thinking, oh, would somebody just put a shim underneath that leg of the table? That's kind of what we're going to look at today. We're going to come back and look at each of these pillars on their own. I want to, first of all, focus on that strong evidence-based program, which is the basis for the table, if you will. It's the infrastructure on which the table sits. And this is the program that you have been implementing, that you've been evaluating, that you've been assessing, that you've been adapting. It's strong, it's evidence-based, and that's where we begin. Because with that program, we then look at how do you build your case for support. One of the most important things that you want to do as you are here is really think about how to build your case for support. Ask, and I know you've gotten some handouts. So please, this is a good time to look at handout number 1. I'm trying to pull that up for you here. Anyway, let me see if I can pull that up this way. But we can ask, if you'll just pull up the handout on your, here we go. Here it is. I particularly like this one because it helps me dig into each of the areas. So when I think about, okay, what's the issue that I'm a solution to, that my program is a solution to? Is it in the area of prevention? It's in the bigger area of of addiction and opioid addiction, but what is it and how many are affected? So this is the one that helps us dig down deep into each of the questions. What do you do? What's your summary of your unique solution? What's your story that you can say it in a way that will grab people? And then, of course, you get to your track record, and this is where you pull out the data and be specific with the data. You're the only ones that know this. You're the ones that can tell your story. Don't depend on anybody else telling it. You have the data. You know what it is. The outcome data, and yes, this is going to have changed over the last couple of years, but you want to look at it, and this is a great one to fill out with your staff, because as you fill it out with your staff, then you know that you're all on the same page, and besides that, other people will come up with things that you never thought about. So you want to continue building your case for support and answering these questions as you go along, and those are all contained in the they're all covered in that handout, barriers to change, etc. So what this gets us to is making your case. What do you usually say when asked about your program? How do you describe your program? Somebody comes up to you and says, hey, what are you doing in that program? What do you tell them in 1 or 2 sentences? So take a couple of minutes to write down your 1 or 2 sentences, and then you're going to have the opportunity to share those in a breakout room with 5 to 7 other people who are also on the call. We'll send you off to I know that many of you all of us have been in more Zoom meetings than we'd like to have been in over this last couple of years. And aren't we glad that we have Zoom? So you understand what's going to happen. You're going to be sent off to your breakout room. Then the assignment will be there for you to describe your program in 1 or 2 sentences. As you're listening, listen to the others in terms of what grabbed me in terms of what they said. Oh my goodness, I want to remember that way of talking about it. Listen to one another in those kinds of ways. We also have helpers with us today who are going to join the call, join your groups off and on, or when they can, if you have any questions, or if you're stuck with anything. So I think we're ready to go. If you'll be in these breakout rooms for about 8 minutes. Natasha?
Yes.
I haven't joined a breakout group yet. I can't see other people's, well, maybe it's just all going lengthwise. On my screen, I can't see other people's videos.
Okay.
Can you see them?
Yes.
Oh, okay. Whoops. Okay. I'll just not worry about that. How's it going so far?
Great. Looks like we've got a couple people that haven't joined breakout rooms. If you guys haven't, if you all haven't joined a breakout room and you need help, just send me a message and I can help you do that.
Oh, I see. Right. Good. Everybody's coming back in.
We found 8 minutes was not enough.
I know, it went so fast, didn't it?
Well, I missed one, so I asked her if she would just tell us in the big room if she's okay with that.
Sure.
There she is.
Okay. Hello. Good.
Yes,
Lashani.
hello.
Hello, my name is Lashani James. I am a prevention educator. I come from the Navajo Nation. I am from the Diné tribe. And my work is located in Farmington, New Mexico. And within my program, we oversee 2 programs, which one of them is called the Strategic Prevention Framework, and the other is called Drug-Free Communities. So with our, for short, SPF, which is the Strategic Prevention Framework, that one is just, we're just creating infrastructure to prevent the onset, just reducing substance abuse. So 3 of our main substance abuses that we kind of oversee and prevent with our Navajo youth and our adults on the Navajo Nation is alcohol, vaping / smoking, and opioids. So those are the main 3 substance abuses that we sort of prevent on the Navajo Nation, since it's so big, and the statistics that shows within our community here. So that one is located within the Fort Defiance Agency, which is sort of like the middle of the heart of Navajo Nation, which I like to call it, which is sort of by Window Rock, Arizona. So that's the whole Navajo Nation there. And with the other program, our DFC, which is the Drug-Free Communities, that one is sort of like the same as the other program. That one is just alcohol and illicit drugs that we reduce among Navajo youths. That one's just for the youth, such as middle schoolers, high schoolers. We're just reducing the statistics there. And we, along with our coworkers, we create flyers, we do outreach, we do a bunch of things just to sort of get the word out that we are preventing substance abuse.
That is great.
Yeah, that's my
That is great. Thanks so much. And you did hit each of those points, each of those questions, which is very important. And it's again, I would say, well, first of all, to back up, we in our group found 8 minutes too short as well. So we are going to have a chance to go back into those rooms with another task, but you'll be able to revisit one another in just a few minutes. I would like to just reiterate that I would strongly suggest that you take this worksheet and change it however it's going to make more sense for you. It's definitely not copyrighted. So if you want to change words and do all of that, but you'll get the essence of it and take it back to your staff or others that are involved with you in the program and do it together, because that gets you all on the same page. And then you want to also, each of you, be able to come up with 1 or 2 sentences with which you can absolutely provide the essence of your passion and the essence of what it is that you're doing. It's wonderful. You all are on such a great footing now to take that on. What I'd like to do now, with that as your background and with where you are now with all of this, I'd like to just start with how we look at sustainability, the 4 pillars. The first one that we talk about is internal support. My experience is that this is one that we so often overlook. We kind of make an assumption that the tribe with which we're involved or the organization that has sponsored us knows what we're doing. They know and they support us, and we don't need to do a lot of work internally. I would suggest to you, and I would strongly suggest that you review this carefully. Do the people inside your tribe or your organization fully understand the program and how it fits with the over-organizational, our tribal mission? Do they get you? Number one, do they know about you? Number two, do they get you? And do you have active support? We're going to come back to the kind of active support I'm talking about. And do key decision makers advocate for your project? For example, if you're in a tribal organization or in a tribe, do the elders know about you? Do the council members, are there council members that know about you and support your program? What about the tribal judges? What about the tribal police? What about the tribal public welfare? Are they tribal Head Start? Are the teachers? Are the principals? What about the other organizations? And that's within your tribal organization. And then within the community, where do you go? But let's stick with the internal support right now. We'll get to external in a moment, but really think internally. And who is it? Internal, what I mean by that is, who is it that is the sponsor for your program? Is it the tribe? Is it the tribal council? Or are you sponsored by an outside organization? The same points apply. Let me quickly pull up. Yeah, I'm not able to do it quite so quickly. Here we go. Let me quickly pull up a handout that refers to this, because I think it's also a really important one for you to do with your group. This, in the ones that you received, this is handout number 2. So you start with the current level of support. And if you don't have anybody up here, then you really better be concerned. If nobody in your organization knows about you, and believe me, there are many programs for which this is true, but this is a good place to start. Who currently supports you? And then where could we strengthen the support? Like, do we have the elder support? Do we have council member support? So you ask those questions very directly and of one another. And then you answer them with as much honesty as you can. So that's internal support. Pillar 2 is resource development. And I know you've all been working on this. There isn't a program in the country that hasn't been working on developing resources. I just want to remind you to think broad. There's dollars and grants. Boy, absolutely great. We all like dollars. We all like grants. Think too, though, about in-kind donations. For example, if you're giving a class or a meeting or a talking circle somewhere and you need a space, is there an organization or is there somebody that can donate that space so that you get it free of charge? That would be an in-kind donation. Consider it such, even if it's natural. Right? Of course, they're going to give that space. Of course, there's room in the school. Absolutely. You're lucky if it's an of course. But consider it in terms of your resource picture and in-kind donation, because the broader you fill out your resource picture, the more energy you bring to your project. Likewise with pro bono services. You know, maybe there's a lawyer in the tribe or in the community who's willing to come and talk about the legal aspects, or a judge that's willing to come and talk, or somebody that's willing to be part of a video. And you're saying, well, of course, that's what we do in this community. I know, and you're lucky if it's of course, but count it as a resource. Because again, it's all about relationships. And the more it's counted as a resource, the more energy you bring and the more stability you create. Also, fee for service. This is great. If you can get Medicare or Medi-Cal or Meta something to help pay for some of these services, great. Source options. There are tribal grants. Sometimes tribes do provide grants. There's federal grants. You're all aware of those because you're probably currently operating under a federal grant. You're operating, as I understand, under a SAMHSA grant. Recognize that there are more federal grants that are also available for drug abuse, opioid abuse, children's awareness, whatever. Be prepared to look broadly. Some individuals are very involved right now. The opioid pandemic, if you will, epidemic. I think it's a pandemic, but it's really an epidemic. People are wanting to support their corporations who have foundations that are focused on this and are not only focused on the opioids, but are also focused on tribal programs. There is, of course, the tribal budget. Can you get money out of the tribe? And then there are other organizations and clubs, both within the tribe as well as outside. Types of partnerships. Again, I'm wanting to broaden your view of what a partnership is. Remembering that partnerships are all about relationships. Let's look at the first one. You probably have partners that are collaborators with you. They are ones that walk maybe side by side, maybe you don't even know it, but they're walking side by side with you in meeting the needs of the people that you're serving. This could be the tribal public health. This could be the community public health. This could be other treatment programs. This could be rehab programs. This could be rehabilitation programs. They're walking side by side with you in providing services to the same clients that you're providing. It's important that you talk with one another, that you recognize that you are collaborating to make this world a better place for the people that you're serving. You can also see where in that, you can also see where you multiply, where you really enhance one another, and maybe where you're doing the same thing. This is one of those opportunities where you look at, okay, what do we really need to save? If this organization is doing that really well, maybe we can put more of our resources in another area. So that's the collaborator piece. Let's look at the advocates. Oh my goodness. We all need advocates, whether we're individuals or whether we're an organization. And these are people who don't necessarily bring a particular resource to you, but they advocate for your program in their own networks. If you're involved in a tribal program, you would want the elders to know about you and to be able to advocate for the program that you're doing. You would want the council members, or some of the council members, even one, to be able to advocate for you on the council and off the council. Again, you'd want the judges, you'd want public health. And when you look in the outside, when you look external at the external community, what about the public health in the community? Do they know about you? And are they willing to advocate for the program that you're doing, which they cannot? So that's the advocate role. Sources of resources we've really talked about. We talked about that on slide 2. That's pillar 2, but that's a different kind of partnership. Sometimes you have partners that meet sort of all three, and that's great. I'm encouraging you to really think broadly in terms of where you have people in each of those areas. Again, it's about relationship, and it's about building the energy, expanding the energy around your particular project, the energy and the excitement, as well as the resilience. Pillar 4, we're to the 4th pillar. We're to the 4th table leg. And this one is outreach. Outreach is incredibly important. The question is, do you actively share what you're doing and why you're doing it? If not, it's a missed opportunity to get additional support. Think about this in every step you take. every conversation you have with somebody is, in a sense, a way of outreach. But then you also want to have a program or and you want to spend time really thinking about how you're reaching out, to whom you're reaching out, how you're doing it, and what you're doing. Here, when you think about outreach, it's good to think back to that first handout, because those are the questions that you want to be able to answer. That's the information that you want to give people. Remember here that you are the only people that can tell your story. You cannot expect that somebody else will be able to tell the story for you. Also, so be proud, be passionate, be specific, and also look very carefully at who it is that you're reaching out to the audience. If you're reaching out to an elder, you are going to frame that conversation in a certain way. If you're reaching out to a judge, you're going to frame it in a certain way. If you're reaching out to a foundation or another funder, you're going to frame your conversation in a way that meets their needs. For example, if the funder or the foundation is supporting tribal opioid overuse, you're going to frame your conversation in terms of how you meet that need. So it's individual, there's general, you have the general outreach, and then you have the individualized outreach. In the generalized outreach also, I'm sure many of you have thought about the ways in which you're reaching out these days. And I know it's different than it was 2 years ago. 2 years ago, before COVID, we were able to get in classrooms. We were able to meet people. We were able to do lots of things one-on-one. Now you're probably more dependent upon social media. So think about it. Do you have a social media presence? Are you on Facebook? Do you have Twitter? Are you on Instagram? And are all of those supported and approved by the tribe and by your funder? Also think about, are you using videos? And are you using podcasts in the way that is the most appropriate and that is getting to people in ways that you never expected it would? It's a new world. It's an exciting world. Sometimes to people like me, it's a little scary world, but that's why we have experts in all of this. So that's the 4 pillars in a nutshell. And now what I'd like you to do is, I'm going to take a deep breath. I hope, and you can take a deep breath. And what I'd like you to do, and this is what we're looking at here, is handout number 3. I'm going to do it first on the colored side, and then I'll pull up the the handout. If you think of the center of the circle as 0, and the outside of the circle as 100%, let's take internal support. Let's say that you just off the top of your head say, well, we're about 50% there. So you put a dot at about 50%. Then you move over to resource development and say 50% or 0 to 100%. Maybe you've done a pretty good job in that. Maybe you haven't done such a good job. Put your your dot somewhere in that quadrant. Marketing and outreach the same, and partnership and development the same. And then you'll connect all of those dots. Are there any questions? Does that make sense? Here's the handout for you to use. Hopefully you have it. If not, it's easy. Just draw a circle on a piece of paper and put the dots in. The handout is a little skewed to one side, but never mind. Consider that 100%. When you finish completing the dots, you will have probably not a complete circle. There are very few of us that have a complete circle. we all have work that we can do on one area of this or another. So take a few minutes and fill it out. If there are any questions, those of you following chat, are there any questions on this or anything we should add?
Somebody wanted to know where to find the handouts.
The handouts came in an email yesterday, I believe.
And we will also be including them in a follow-up email that we can send out after the presentation today.
Awesome.
Okay, so if you don't have a handout, use a circle, divide it into 4 quadrants, and then the 4: internal support, partnership development, marketing and outreach, and resource development. Yeah, let me get this.
Justine, just to clarify, the closer you are to the center of the circle, the stronger you are.
Sorry, the other way around.
The other way, okay.
The closer you are to the center, the weaker you are. That's 0%.
And if you
I don't think anybody's there. If you're out at the edge, you're there. You've got this one wired. Internal support, oh golly, everybody in the tribe knows about us and supports us. Resource development, we have resources coming out the kazoo. I talked to somebody yesterday who said they're calling me to see how they can offer. That's great. That's great.
So just to clarify, Justine, like you were talking about internal support. So would they draw from, like if it's 50%, how would it look?
Let me see. Now, can you see my arrow? Whoops, no, you can't. Sorry. There we are. Do you see a dot there?
Yes.
So you put a dot right there. That would be about 45, 50%.
Okay, right. It's right in the middle. Okay.
Yeah. Then resource development is about 33%. Marketing and outreach, you see that little dot? That one is about 75%. Partnership development is about 75%. And I didn't connect them, but you can see if you connected them, oh shoot.
To draw like that, right?
Yeah, you just connect the dots.
Okay.
It's a dot to dot.
Oh, you connected, you don't have to make the round circle.
No, it's not going to be round.
Okay.
It's not going to be round.
It's
going to be sort of out of shape. It's a table with not very, some legs are strong and some legs are weaker. If we were sitting at this table and somebody talked about resource development, we'd go right off the edge of the table. Okay, does that all make sense? Thanks for those questions.
Yes.
Is there a cheat sheet that helps you right size your circle in the end?
The cheat sheet is what we've just gone through. Let's look at resource development, right? So that one's not very strong. And this is what we're going to be talking about when we get in our groups. So I don't have very strong resource development. So I'm going to talk about, from the point of view of what we've just heard, who's out there that I haven't gone to? What have I done that I've been turned down with, or what haven't I done? Are there people that I haven't gone for? Are there funds that I haven't explored? Who do I go to get help in how to expand this part of my circle? Does that make sense, Joanne?
Yes.
Internal development, if I want to expand that one, then I go to that worksheet and say, okay, who do I need to go to? Some of my tribe are supporting me, some of the community are supporting me, who isn't? And how do we as a group get to that person so that we have stronger internal support?
So Justine, could I ask a question about letters of support when they're going after grants? Would that be internally, or could that also be with your partners externally?
Oh, absolutely. Absolutely. When you want letters of support for a grant, look at both of these areas. The grantor is going to wonder if you have internal support. Like, are they just giving it to you as this little column out there sitting in the midst of no support? So they're going to want to know, okay,
Oh no.
the tribe supports this program, right? They're also going to want to know, are there others out externally that are supporting the program? Because the more support a funder sees, the more they're going to be able to fund it, because every funder only wants to support things that are going to be successful. They want to spend their money where they're going, where, yes, they're willing to take some risk, but they want to take qualified risk. They want to take risk that they know is manageable. So if you have internal support letters as well as partnership out external support letters, perfect.
So in the chat,
Yes.
I see Teresa has made a comment, and I think that's a really interesting comment, because she says she just went into a new job. And so she said her circle's at 0 right now because she's just transitioned in. So what kind of recommendations would you give her for building each one of those quadrants?
Well, and I think the first thing, I think the first thing is to really do some research and ask questions about, like, as you're new, you get to ask questions that you don't get to ask as an outsider, as not an outsider, but as an experienced person. As an experienced person, people would think, well, you're supposed to know that. But as a new person, you can say, look, how are we supported in this project? Where is our support within the organization that is supporting this project, right? Whether it's the tribe or whether it's an outside public health agency. You can ask those questions. So I would say, first of all, gather information. And I think it's valuable to gather information in these 4 areas. For me, I have a logical, but I have an intuitive mind as well. But my logical mind likes to see things in buckets. So if I can gather information in terms of where are we internally, what partners do we have? What do they give? Are they money partners? Are they in kind? Those kinds of questions. Let's see that marketing and outreach that we've done. And resources, where are our resources? Let's look at the budget. Let's look at what's coming in. So I would say to a new person, start fresh. And I really like gathering information in these 4 areas. So let's move now into, how are we doing for time? Whoa, we need to move into our, into our breakout groups, and they're going to be the same ones. But what I'd like you to do in your breakout groups is share where you are. I mean, yes, you might have your circle filled out or your diagram filled out that's not a circle and it's a little bit cattywampus, and that's fine. How do you rate the current status of each pillar for your program right now? And again, this is just how do you rate it? It's not data driven. It's, you know, where you are. So how do you rate it? And where are you the strongest to date? And why are you the strongest? Share a win or accomplishment or any lessons learned. Because particularly in your strongest, because somebody else might be in their weakest. And then what challenges have you faced and how are you addressing them? You're going to have about 15 minutes. So enjoy. I think this conversation is going to be filled with information and delight and questions and sharing. So have at it, everyone. Thanks. Let's see what time it is. And to go from there. And then think about the specific next steps you will take, a timeline, who else in your group needs to be involved, and most of all, what ideas did you learn from your peers today that can help you as you move forward, that you want to take along with you. I'm trying to pull up and I'm not having much luck with it right now, but I think here, maybe I can do it from here. Okay, handouts 4. Oh, wait, let's do 5. There's 5 and I missed 4, but hopefully you have 4. But 4, let me just describe to you what 4 does. 4 helps you look at each of the pillars and talk about, where you are now, what are the blocks to moving forward in that pillar, and what do you need to do to remove those blocks. And then the handout number 5 is building the path forward. And here is again for you to think about, how do each of the components contribute to the sustainability of your program activities? How are you doing in each area? You've talked about that today, but I would take it back to your other staff and share that with them again, so that you get as many people as possible on the same page with you. Some new ways to think about your efforts and where's the best potential return on your investment of time and focus. So that's 5. And then, yeah, there we go. Let me get this one out. So we're getting, sorry guys, there we go. My computer's moving a little slowly. We're getting to the end of our time. So here are the takeaways that I hope you'll take. Resilient sustainability is a mindset plus strategic action over time. It's focused, and yet it's tailored. You tailor the sustainability plan, you tailor your resilience plan to your specific context. What needs to be sustained anyway? And where are the strengths and the gaps? You've been working on it, but start now in a more focused, defined way. Focus on each pillar. Be proactive. Again, I come back to the internal, keep the key players in your organization informed. Be proactive, not reactive. You guys can all think out of the box. You wouldn't be here if you couldn't, but continue to think outside the box. Think of those other possibilities. It can open new doors to new partnerships and resources. And tailor the outreach, regardless of the channel used. Clarify the purpose, what you want people to do, and what their interests are. Okay. Thank you. Thank you so much for including me in this time with you. You've all been great. I appreciate your time. My information is on the handouts. I know if you haven't received the handouts, you will. They will also be posted with the recording of the webinar. And my hope for each of you is that you're able to take from this the knowledge and the strength that you know what you're doing, that you're very resilient individuals and resilient organizations, and you're just going to expand that into your daily living. So thanks.
Miigwech, Justine. This has been awesome. And you're getting like rave reviews in the chat box. So
thanks.
Yes, this is really great.
Thanks. I don't have the chat open because I didn't want to be distracted. But know that I'll open it right now. Know that I have so enjoyed being with all of you. I've felt your energy and I've loved it. Oh, just what the doctor ordered. I love being what the doctor ordered. Oh, blessings to all. Thank you. I appreciate all of you too. Blessings to everybody.
Justine.
Yes.
Say miigwech.
Say miigwech.
Miigwech. There you go. It means thank you. Yeah, all right.
Oh, wow. Thank you so much, Justine. Miigwech. Thank you, Shelley.
Miigwech.
Thank you to everyone who joined us today. We especially thank Justine, Shelley, Pam, Joanne for taking their time to share their time, their knowledge with us and their resources with us. We really appreciate you. We really appreciate you. We appreciate everyone who joined us on this call for visiting with us. We hope this has been helpful. Please fill out our GIPRA survey to let us know how you like this training. And we hope that we see you soon in other future webinars. Please don't hesitate to reach out to any one of us, to Justine, Shelley, and we'll be able to help with any technical assistance, any follow-up you would like after this training. I'm beginning to feel like we're going to have to bring this back by popular demand, but Justine and Shelley about that. Everyone.
Well, it's my honor. I'm passionate about this, as you know, so I love helping people think about where they are and how they can strengthen where they are. So thank you.
Thank you. All right, everyone. We'll let you get back to other things. We look forward to seeing you in future trainings. Please look out for the follow-up email that will have the PowerPoint, handouts, and other resources. Talk soon. Thank you.
Miigwech.
Miigwech.
Miigwech. I love that.